Hello everyone. Today's session is on Learning Outcome 2, which will be to understand professional development in health and social care. And my name is Shazia Khan. So we'll be looking, before I give you an overview of what we'll be doing in Learning Outcome 2, I want to firstly give you a summary of what we did yesterday. And I just want to understand if you lot understood what we did in the session yesterday as well. So it gives us a little bit of an idea of your learning process as well, and your own personal learning curve as well, and how it enables you to learn. So just to identify, learning outcome 1 was to do with personal and professional development. And when we talk about personal and professional development, what is the difference between them? Do you remember what we did in yesterday's session?
Yeah.
Can you tell me what's the difference?
One is to do with self-improvement and developing your personal life, and the other is to maintain and earn professional credentials.
Yeah. And is it important to have this kind of professional and personal development in your life?
Yeah.
Why do you think it's so important to have it?
So you can improve and become
So
a better version of yourself.
Yeah. And also people have future aspirations, don't they? They want to aim for that goal, and they want to get as far as, they want to progress in their career. So in Learning Outcome 1 in yesterday's session, we looked at careers in health and social access points for careers. We looked at roles and responsibilities in health and social care. What kind of roles and responsibilities did we look at? Do you remember? We had direct care roles, things like rehabilitation workers, personal assistant. Then we had management roles as well. We also looked at other social care support roles, housing support officers, welfare rights officers. Why is there need to have other care support roles within the health and social care profession?
So
things like welfare rights and things.
So everyone's needs can be met.
Yeah, everyone's needs can be met. And if it may be that someone is, has issues with housing benefit or disability allowance, or even, is homeless, so they'll need support from different services out there, and we should be able to offer that. We looked at regulated professional roles as well, things like registered nurses, complementary therapists, counsellors, social workers, how they have an impact on the health and social care profession. And social workers do have a big impact in regards to safeguarding, mainly to do with children when they come into, the hospital, and issues around safeguarding. Ancillary roles, we also looked at the progression from in the health and social care profession, things like, registered managers, what qualifications they need. We looked at a social worker and the experience and qualification they need, nurses, team leaders, occupational therapists. We then went on to look at skills and knowledge required for a specific role. What kind of skills should you have?
Positive mental attitude.
Yeah, positive mental attitude. Anything else?
Communication skills.
Communication skills. Why is that so important?
Because most of the roles you carried out, if you are not a good communicator, you may not achieve the intended purpose.
Excellent. What else? What else could we have? Remember we said, what about like things like dealing with pressure? Remember, in the health and social care profession, healthcare profession, you need to deal with pressure, don't you?
Yeah. Being able to accept criticism.
Yeah. Being a team player, and things like flexibility and things like that. Personal development, we also looked at skills required, active listening. Why is it really important to listen actively?
To be able to improve when someone gives you criticism, and to be able to make your patient feel heard when they're asking you to do something for them.
Yeah, so to make sure that people feel like they're being heard as well, because sometimes you get people that don't listen, and it's really, really hard, when they're looking around whilst you're talking. I've got students like that sometimes as well in class who don't, listen, and then when they're looking around, and you think, so active listening is really important. Working people with disabilities and challenging behaviour. So things like that we looked at learning outcome 1, okay? And we also, I gave you a task to do. I don't know if any of you have done that. So let's go to learning outcome 2. So learning outcome 2 is to understand the professional development in health and social care profession. The indicative content for learning outcome 2 is to understand membership of professional bodies, standards and codes of practice, continuing professional development, what it is, why it's required, and professional requirements. We then went on to look at what professional development is, and we referred to it as, obviously, it helps your own learning. Okay, you as an individual need your professional development. It's a self-improvement kind of task, that has a positive impact on different areas of your life. Like Jessie said, be it work, be it your life, personal life. It's a way of achieving your goals and realizing any sort of potential that you have to achieve these goals, be it personal or within your career life. I mean, when we talk about personal development, and it's just asking just a general question to all of you, do you think about your personal development?
Yes.
Yeah. How do you
Yes,
think
we do.
about, Olu, how do you think about your personal development as a person yourself? It could be anything. It don't have to be work. Just tell me how you think about your personal development.
I try to measure my growth as per time,
Okay.
and ask and tell myself what I need to know
Yeah.
for the next phase.
Yeah. Do you think it helps you?
It helps me
Yeah.
because it gives me self-confidence of what I'll be able to know.
Do you think you have a focus on what you want to do in life then?
Yes.
Yeah. Anyone else? Islamia, are you? Jess, Victor, anyone? Does anyone think about their personal development? Does anyone think about improving themselves? Does anyone think about, their future?
Yes, we do.
Yeah.
As he explained, the more you think about it, the more you measure your
Yes.
present day to your future, where you are and where you want to go. You measure, you mark, you score yourself.
Yeah.
What I do most, I score myself. Have I been able to achieve this thing in this time?
Yes.
Where am I going? What else should I do to get to where I want to go?
Yeah.
I've been thinking of my retirement plans. What are the aims and objectives? What do I need to know? What do I need to do again? So I
Yes.
can have this kind of retirement, this kind of future for the children, this kind of thing for my wife. And
Yeah.
so it's always good to always reflect on these things. And I always do that.
I totally agree with you 100%. I think it's really good to not stress yourself out, but to have in place your future development, any sort of personal developments, that you want to, improve your family life, anything like that, and your professional development, that you in the long term want to progress to a higher role, and you want to, try to adapt certain maybe technology in your working life, attending courses. I always, for my personal development, I'll be honest with you, I always want to do more. Like, I love studying, so I like to do different courses, even if it means paying for the courses. So I like to improve my future aspirations and my career goals, to make myself better as an individual, but also to boost up my CV as well. It's a way where you could, if you have a personal development and professional development in place, a plan, you could be true to yourself. You can set yourself goals. Sometimes you won't meet them goals, but you've got to be clear, what goals you want to meet and why you want to meet them. So, it is important. It's one of the elements of professional and personal development, and it's one of the elements that individuals want to do to try to improve themselves. Okay, so did anyone do the survey at NHS website? No?
My Moodle hadn't updated until this morning, so
Oh, no, that's okay. So what I'll do is I'll just bring up this. It's identifying different types of jobs. So let's have a look if I can bring it up. Okay, so can you see this? So it's just a quiz, okay? And it just gives you, it takes about 5 minutes, and it says there are more than 350 careers in the NHS. And this is a simple task to answer some questions to see what your career is. So let's start. Can you all see that?
Yes.
Let's see what what I should be. Qualifications. So what level of qualification do you have or hoping to achieve? So I've got a degree. That's next. If it gets there. Follow instructions at the end of the set of questions will deliver. Oh my God, there's 50 questions. So what I'll do is I'll leave this for you to do for the next session, okay? So make sure that for the next session, for Learning Outcomes 3, next Saturday, you do this, and we'll come up with what your, just remind me at the start of the session, and we'll come up with what your career quiz is, okay? So make sure you do this, okay? The link is on the slides. Okay.
Okay. I was about to
I'll
ask you.
I'll show you the link now, Islamia. Just 1 minute. I'll bring the slides back up. So here's the link. Can you see the link there?
Yes.
That's the link. So for next week, before we start Learning Outcomes 3, this is a little bit of a quiz, but also identifies what your results were when you went through the questionnaire. So make sure you do that for next week, so before we do the session Learning Outcome 3, and it'll just be nice to see who wants to do what, or which career someone wants to take. Okay, so please do that for next week. So we'll start with 2.1. It identifies standards relating to professional development. Okay, the Professional Standards Authority and what they deal with in regards to that. It's so important to have standards in place, okay, because you know, it's there to raise your standards within the health and care, working in health and care profession. And the Professional Standards Authority is an independent organisation. It's accountable to UK Parliament, so legislation, anything that they have to follow that legislation. And it's there to protect the public through the work with organisations, and they register and regulate people working in health and social care. So that means, would they regulate doctors working in that profession?
Yes.
Yes, because if you are not registered, are you a professional doctor then?
No.
No, and that does happen in certain countries, you know, where there was instances where they weren't registered, you know, but you have to be registered with the body to identify your role. For example, if I am a solicitor and I work within the UK legal system, I need to be registered with the Solicitors Regulation Authority, because if I'm not registered, what happens? What do you think happens?
You are not covered if anything peradventure happened.
Yes. So I'm not qualified then, am I? I'm not qualified, no. So I need to be registered with the awarding bodies. Now, the Professional Standards Authority, you know, promotes any sort of health and safety and well-being of patients, service users, and the public, and it's regulated, and it's accredited, and it follows legislation and laws. Why is it important to follow codes of practice and laws?
So everything's safe.
Oops, sorry. Any of you? Why is it, do you think it's so important?
So that everybody is safe.
Everybody is safe, yeah, but we have to follow codes of practice, because what do we need to maintain? Safety of people, yes.
Everybody doing the same thing.
Yes. Do we need to maintain that we are following the laws passed in the UK?
Yeah.
Yes. It's so important to follow. Olu, did you want to say anything else?
Why we need to follow up the codes and standard of the organization is so that nobody can deviate from what's been laid down. And
Yeah.
also we can also be updated of the recent research in our field so that we
Yeah.
can also be up to task.
Yeah. And to do, you know, if we don't follow the codes of practice or standards or any sort of policies and regulations put in place, then we are not, you know, ensuring any sort of safety for the patients, are we? Or for anyone else that's coming, you know, into the organization.
We
You
are
know, we
not.
need to maintain that safety.
Yes.
We need to maintain that, you know, we are following the standards, and we're not neglecting or abusing or harming anyone or neglecting our sort of, you know, our you know, our you know, care for that individual, you know, because we need to be looking at things like that. And you know, the whole purpose of professional standards is that, you know, we look at behavior as well, you know, that we have values in place that we follow, you know, and the Professional Standards Authority values, they have five main values, which are integrity, transparency, respect, fairness, and teamwork. And you know, it is important that we follow them, and they are regulated by the government. Okay, so these make up standards to follow for good practice in working. So we've got standards to follow, we've got laws to follow, and we've got regulations and codes to follow. You know, it's not something that, you know, that you could just say that, oh, you know, the Care Standards Act, you know, I'm not going to follow it. You have to follow these regulations. So we've got the first one is the Care Standards Act, which we'll go through each one in more detail. And if you have any questions, please just ask. So Care Standards Act 2000, Domiciliary Care Regulations 2002, Health and Safety at Work Act 1974, Manual Handling Operations Regulations 1992, Management of Health and Safety at Work Regulations 1999, Codes of Practice and National Occupational Standards. Why do you think, again, and we go back to why is there need for these? Why do you think there's a need for all these laws and policies in place?
So that the care worker or support worker or anyone working in a care sector can really know the guidelines of each role they are carrying out and their rights and also what they don't need to do.
Yes. And also that people are consistent, isn't it? You know, people need to be consistent with this. Everyone needs to be singing from the same hymn sheet, and they need to be following the laws. So the first one we're going to go through is the Care Standards Act 2000. And this act received royal assent in July 2000. And the act reformed the regulatory system for care services in England, replacing the arrangements set out in the Registered Homes Act 1984. The act the aim of it was to reform any sort of inspection and various care institutions. And it was there to look at providing the same care standards as independent sector providers. So only agencies that provide personal care need to be registered. And the Act also introduced the independent regulatory body for social care known as the National Care Standards Commission. So when we look at this Act, do you think there was a need for this Act to be brought in place?
Yes, because it's going to help the regulatory bodies to know what they need to do.
Yes. This act is about things like, you know, registration, regulation, training of social workers. And Why do you think there was a need for this act to come into place in regards to training for social care workers?
It's because of the personal and professional development.
Okay, so what do you think? What do you think? So do you think the social workers were working well at that time?
They are not working very well. So,
No.
and they want them to work very well in order to save people's life.
So what the cases that were that had come up in regards to this, you know, like things like you know, where the social workers were not protecting children's rights?
Why the act really came on board is, number one is safety was not really in place.
Yeah.
Safeguarding issue was not even put in place, and some of the care workers also, they work things at their own level of understanding, not mindful of the person's care they are also
There was
doing.
also there was also at that time, I don't know if any of you remember the case of the Victoria Clembe. Does anyone remember? Do you know Victoria Clembe was a young, I think she was about 5 or 6. She was a young girl that had been brought over from Africa and was killed because of her auntie. Her auntie had brought her over, and her boyfriend. They were found guilty in February 2000 in regards to murder. So they were found guilty. And there was a lot of issues in regards to that, in regards to the issue of social workers, you know, whether they were trained properly. So this case was, you know, quite a popular case in regards to it's a Victoria Clembe young girl. Such a sad case. But it was in regards to how the social services didn't do their jobs properly. So this act looked at training of social workers and also providing childminding or daycare and looking at protection of children and vulnerable adults in both homes and schools and colleges. When we talk about vulnerable adults in daycare, what does that mean in nursing home? Has there been instances where vulnerable adults have been targeted as well? What do you think? Have there been in nursing homes, has there been issues where elderly people have been
Yes.
Yes, okay.
There's been so many in the case of abuse,
Yes,
sexual abuse, financial abuse,
yes.
and so on. All these things brought up the Act of 2000, the Care Act 2000, to curb all
Yeah.
those things.
So there were loads of abuse going on within care homes. You know, the elderly people were being pushed around. They weren't looked after properly. You know, so you know there was a need for all these changes to come about. So the act itself, the Care Standards Act, looked at these elements. So it looked at local authorities will have to be regulated and meet same care standards as independent sector providers. It also looked at only agencies that provide personal care need to be registered. The Act introduced the regulatory body for social care known as National Care Standards. And the Act also looked at regulations and qualification framework. So we've been through that a little bit on regards to what the Care Act actually dealt with. The next one is the domiciliary care regulations, and this looked at live-in and home care options. What is live-in and home care options? Anyone? What is live-in and home care options?
Okay, you said what is living home care?
What does live-in mean and home care options? What does it mean?
It means when care is being provided in a residence instead of going to a care home, where you get your care and treatment in your own home. So
Okay.
care workers have to travel down to your home
Yes.
to give you the care instead of you being in a care home, a general care home.
And why do you think that laws are needed for that?
So that the same thing that's been achieved in a care home can be
Yeah.
achieved in a living care home.
Yes. And that what they're doing is correct. So they're not, abusing the person, or, there's any sort of issues around, how they're treating that individual. So, laws need to be put in place for that. The next one we're looking at is health and safety at work, and that's really important, health and safety. Why do you think health and safety is so important? Jessie, why do you think health and safety is so important?
To prevent injury.
Yeah, prevent any sort of injury. But as a manager, Jessie, would you make sure that you have a safe space for your employees there as well?
Yeah, of course.
Yeah. So it's the main act, the Health and Safety at Work Act 1974. It's referred to as HASWA, and it's the main act that governs the health and safety in laws in the UK. And employers, your employer, your manager, has a duty and responsibility to provide any sort of, health and safety issues. Make sure that they are being followed. What can be a health and safety issue?
Fire
Clients,
escape.
okay, yeah. Providing health and safety for clients. What kind of stuff would we do, Jessie? What could it be?
Maybe hazard.
Sorry, what was that?
Sorry, my baby's hazard.
Oh,
I'll just for now.
I think they want to join in, don't they? So health and safety could be things like, ensuring that employers are not affected every day in their activities at work. You should also, as an employer, you should make sure you do a risk assessment. What's a risk assessment?
Risk assessment is you are trying to do evaluation of the
Yes.
safety required for the
Yes.
particular task you want to carry out.
Yes. So you need to make arrangements around the safety, yeah? You need to monitor and make sure there's preventative and protective measures put in place. You need to regularly audit all the health and safety measures. Make sure that they are not breaching the Health and Safety at Work Act. You need to appoint maybe competent people to implement measures that comply with health and safety. You need to make sure that you communicate health and safety to workers. Why is it important that you communicate health and safety to workers? If you are working with substances or anything within your workplace, why is it important to give training to your employees?
To prevent something from going wrong,
Yeah.
especially with substance, to prevent overdose.
Yeah, especially.
And
And what about, Jessie,
others-
what about in the health and social care profession?
to prevent others from getting substance when they want to use it for personal use and
Yeah.
shouldn't be using it.
And is it a legal duty that you have then?
Yes.
Yes. It's a legal duty within the Health and Safety at Work Act that identifies that, you owe a duty of care to your employees. You make sure that you provide a safe equipment for them, any sort of safe use of handling, storage, if there's any sort of issues around, making sure the environment is safe for them, any facilities, any sort of, safe means of entrance and exit. So you as an employer need to make sure you are following the Health and Safety at Work Act to make sure and to prevent any sort of harm to anyone. And you have a duty of care. And if that duty of care is breached, depending on how severe that is, it could be a criminal offence. So, the Act is there to protect individuals, protect you as an employer as well, and make sure that you are following this. The next one we're going to look at is manual handling operations regulations. What's manual handling? Sorry, what's that?
All right, manual handling is
transferring of transporting of loads and then heavy stuff. What's it called?
Yes. What do you think? How do you think that is
Like
covered in
pushing.
health and social care?
Pardon?
How do you think that's covered? The manual handling operations regulation. How do you think it applies to the health and social care profession?
It applies to us because of our general physic, like general well-being.
Yeah. So
Yeah.
could it be?
So it's.
Could you give me an example of how it would apply to, for example, you in your setting, in your job? How would it apply to you?
So getting a training,
Yeah,
during the manual handling is very important,
yeah,
and because it's if you're not trained, you'll not be able to do the proper way of manual handling,
yeah,
like pushing, pulling, and
yeah,
so many heavy objects.
yeah,
You can't just pick it up
yeah,
because of your back and all stuff. So
yeah,
it applies to it is one of the thing, aside the health and safety, it is one of the major things we
yes,
should always put in practice.
yeah,
Every 3 months or 1 month, it
yeah,
should be done.
yes,
So it applies to all staff, member of staff working in care or
yeah,
any other organizations.
yeah. It's the manual handling regulation sets out guidelines enacted to promote any sort of safety in the workplace. So like you said, it could reduce the risk of injury from activities such as lifting, maybe carrying, pushing, pulling objects, so employers are required to have risk assessments in place to make reasonable adjustments to kind of minimize any sort of hazards. So if you're pulling if you're pulling a trolley, or if you're working in a care home, you've got a hoist, you should be offering training, and you should be, if one person can't deal with it, you should identify that more people need to deal with it. I know some organizations won't follow it rigorously, but you need to make sure that, because it's a risk assessment,
Yeah,
and it needs to be, like you said, people
needs
need the
to be
training.
practicable.
Yes. And also, if there's if there's a new equipment being installed, maybe in the hospital, you need to be trained, don't you? You need that training.
Yeah.
Because you need to be able to say that you have had that training, and it's a responsibility of the employers to create this kind of safe environment. If you don't have that training on manual handling, then you're not going to be able to do things around using that equipment. So, and they also encourage to avoid any sort of manual handling activities as well. Things like lifting and the way you lift, to prevent any sort of back injury or anything like that. Training is really important. Employers should provide suitable equipment to facilitate safe manual handling. So this could be things like lifting aids, trolleys, hoists, and it should be monitored. Why is it important that it should be monitored? Why
So
why
that
should
people don't get hurt.
sorry?
So that people don't get hurt.
Yeah. So it prevents any sort of injury. So you're right, Jess, because if you don't implement the manual handling regulations, then people are going to get hurt. And if you follow them, people will not get hurt and there won't be that many injuries. So it could be things like, it prevents injury prevention. It's also, if you follow the regulations of manual handling, do you think it would increase productivity and people will work better?
Yeah.
Yes.
Yes.
Yeah.
Yes.
Reduce any sort of injuries. it also will improve, make the workplace quite positive. People will want to work there because they will feel safe, won't they? Also, it's a legal obligation. So, you know, employers would have to comply with the manual handling operations regulations. Failure to comply can be legal consequences, and it could be things like, you know, fines or potential lawsuits. You know, so you have to follow these regulations and codes. It reduces financial costs, so working employees, including medical expenses, and it enhances your reputation as a company. You know, you'll have a really good reputation, and it's also really, really crucial within any organization to maintain a healthy and safe work environment. And adhering to regulations, employers will ensure a well-being of their workforce, reduce the risk of any sort of injuries, and have a positive culture. You know, so there are benefits of having the manual handling operations regulations. Do you think a lot of companies previously did not follow this? What
Yes,
do you think?
because
Yes.
the essence of having the manual handling operation act is because in the past many people
Yes.
the essence of the care worker is to make sure that the resident and the provider are in a safe condition, irrespective of the task we are trying to carry out. So because these are not in place before, the regulated bodies have to put this in place so that people will really know for each task you want to do. Maybe you want to carry the host, this is what you need to do before you can put a resident, and this is how to also prevent yourself from injury after carrying out the whole task, and that's why
Yeah.
it was put in place.
So do you think having this in place has reduced forms of injury and stuff?
Yes.
Yeah. So there is a need for these. I mean, people say there's so many laws and so many issues in place, but there's a need. Because people there's been issues around breach, there've been issues around failing to comply with these laws, you know, so that's why there's a need for these laws to be brought in all the time. The next one is Management of Health and Safety at Work Regulations 1999. And this regulation was introduced in 1999 to reinforce the Health and Safety Act 1974, where the Health and Safety Act outlines employers' legal health and safety obligations to their employees, contractors, and members of the public. The Management of Health and Safety at Work Regulations 1999 goes further, and explaining that employee must identify the risks that employees, contractors, and members of public may face and take steps to control or mitigate those risks through a formal assessment process. The regulations state that this should be carried out by businesses that have more than 5 employees. So, you know, the whole point of it is to effectively plan, organize, control, and review any sort of preventative measures, and apply and adhere to the general principles of prevention. Carry out regular checks. Why do you think it's so important to carry out regular checks?
And the essence of carrying out the regular checks is to ensure that they are still in force.
Yeah. But if you're carrying out regular checks, are you making sure that employers are following the regulations?
Yes.
Because sometimes, you know, if you, just an example, if you are a nurse, yeah, or a care assistant, the safety thing to do is wear gloves when you're dealing with things, yes? To make sure that there's no sort of infection or anything like that being spread.
Yes.
Sometimes employees, yes. So sometimes employees won't wear them, will they? Because they think, oh, it's too much hard work wearing the gloves, and then, you know, but that can cause issues. So,
Because,
you know,
like,
it needs to, they
for
need to make
example,
sure
now,
that they actually, yeah,
for example, if you are using a host, a
yeah,
host supposed to be serviced after like 6 months. So when you are doing a regular check, you'll have checked
yeah,
that okay, this host cannot be used for a resident presently.
yes,
Yes, so that's the
yeah,
essence of the management
yeah.
regulator.
It could be any sort of machinery, you know, you need to make sure as an employer that you're checking on your employees that they are not doing things wrong, especially I will say this in the health profession, because you need to be careful what you do, because if you do something wrong, okay, you're breaching the law, but it's negligent. There are cases of negligence. And it's not just from care workers and then, you know, nurses, it's from, you know, doctors that have not followed the regulations and the requirements. So you need to make sure that you carry out regular checks, and you need to make sure where there's measures are needed in place to protect individuals. Because, you know, I've dealt with cases of negligence. I've dealt with loads of cases of negligence. And it's not just care workers, the majority is doctors. So, you know, it needs to be, you know, checks need to be done, risk assessments need to be done, and you need to make sure you plan, you organize, you monitor things, and you know, make sure that you adhere to the principles. Is everyone okay with that?
Yes.
Any questions? Okay, so now we're going to go on to the next one, which is another important element of it, the Mental Capacity Act 2005. And this is a comprehensive framework for decision making on behalf of adults aged 16 and over who are unable to make decisions for themselves. So people that lack capacity, who could that be? Could it be a person who has mental health issues?
People that have mental issues,
Yeah.
challenging behaviors sometimes
Yes.
also.
It can be someone who's, you know, unable to make a decision for themselves. You know, capacity is someone, it refers to everyday ability that individuals possess to make decisions. If you lack capacity, then are you able to make a decision?
No.
No. So, I know, Jess, you were saying that you work with people with, is it special needs?
You said?
Yes. Yes.
Do you find it difficult sometimes to communicate with them because of their lack of capacity?
Yes. Some
Yeah.
of them are non-verbal,
Yeah. And
but they can listen and they can understand me
yeah,
if
but
I speak
yeah,
very to the point.
it could be people, you know, but it's sometimes difficult for them to make decisions for themselves.
Yeah.
Things like, you know, financial decisions is a big one.
Yeah.
You know,
These are children that I work with.
oh,
So
your children, yeah, yeah. So for elderly, you know, it could be people that have dementia, you know, that don't understand what they're doing. People with mental illnesses, learning disability, anyone that has brain damage. You know, these people, anyone that's had a stroke, heart attack, you know, these people sometimes will not have the mental capacity. You know, they must understand. Why is it important that a person understands what they are doing?
so they can make informed decisions
Yeah. And
and
if
can consent.
they can't, then this act would be the one that would apply to it. And there are 5 important principles in that diagram there. The first one is that the start off by thinking that the individual can make their own decision. Secondly is give all I can't see that, predictable support to enable the person to make their own decision. Thirdly, never say someone can't make a decision, but because someone else thinks it's wrong or bad. Fourthly, when an individual can't make their own decision, someone has to make it for them in the best way for them. And fifth, when someone makes a decision for an individual, they must consider whether there is a less restrictive option. So, you know, these elements are really important in regards to the Mental Capacity Act, because, you know, there's a need for that act to try and, you know, prevent anyone from, you know, the whole point of it is to try to protect and empower vulnerable people and not to make decisions for them, you know, but even though, you know, sometimes they may not have the capacity, you know, but it would be, you know, someone who is quite ill, or who has a mental, you know, who doesn't have the ability to make a decision. So then this act would apply in regards to that. The next one is codes of practice. Now, code of practice is really important in regards to, especially in the healthcare profession. And, you know, anyone that follows a code of practice, you must follow the code of practice to reassure that any sort of you're providing a safe and compassionate care of high standard and confidence to challenge others who are not. So the code, you know, will there to help individuals. And it's a list of statements that describes the standards of professional conduct and practice of social care workers as they do in their daily life. An example, all employers follow safe practices and safety rules. Oops, sorry, I've just gone off. Safety rules to implement any sort of, you know, safety regulations they must follow. Why do you think it's important to have codes of practice in place? Why do you think it's so important?
To maintain stable workplace.
Yeah. To make sure that standards are met. Olu, did you want to say anything?
The essence of code of practice is, you know, to ensure that standard and specification has been well detailed, been carried out by the provider.
Yeah. So it could be a healthcare professional, a support worker, social worker. You need to make sure that they are following, you know, the codes of practice, what they're expected to do, you know, what standards they are expected to meet. Any sort of, you know, it's all about looking at ensuring that the work they are doing is providing a high quality healthcare and support for the individual. You know, the public around them, they have a duty of care to ensure that they do not fall below the standards. So they have a set standards. The 6 codes of practice in health and social care profession. There's 6 main codes of practice. So firstly is, as a social care worker, you must protect the rights and promote the interests of service users and carers. As a social worker, you must strive to establish, maintain the trust and confidence of service users. Independence of service users is another one. Number 3, protecting them from any sort of danger or harm. Number 4 is respect the rights of service users while seeking to ensure their behaviour does not harm themselves or others, and looking at the well-being as well of that individual. 5th, to uphold public trust and confidence in social care services. And finally, to be accountable for the quality of your work and take responsibility for maintaining, improving your knowledge and skills. Why must you take accountability for your work?
It makes you to be responsible.
Yes. And if you are doing something wrong, is your employee the one who's doing it wrong, or you?
I'm the one doing it wrong.
You are the one doing it wrong. So why? So it's so important that you are accountable for your work. You know, and I'll give you an example in the government. It might not be a good example, but I'll give you an example. Sometimes, you know, ministers, they should be accountable for what they do. Yeah, for their own work, if there's any discrepancies or anything. But what ministers tend to do is make the civil servant accountable and sway away from that. So, you know, you need to make sure that you are doing something that you are accountable for, you know, that you have done it. You are the one who's done it, not anyone else. Okay, the next one we're going to look at is national occupational standards. And they describe any sort of to help individuals, organizations and training providers to improve any sort of performance. They're useful for carrying out a wide range of activities such as workforce design, management succession planning, managing performance, recruitment and selection, personal and career developments and any sort of assessments. Within the healthcare profession, they describe the knowledge and understanding of an individual, their needs to have, and what they need to be able to do in order to be safe and competent in practice. So, in regards to that, they need to make sure they, individuals are provided training to improve any sort of performance. And they need to carry out a wide range of activities such as workforce design, management, succession planning, and quality improvement, to make sure that the work that they're doing is of a high standard. They also will define the roles of work, staff recruitment, supervision, any sort of CPD development needs and planning. And it's really important because, they need to make sure that the staff are up to date with all sorts of, training. I mean, why do you think it's so important to be up to date? Why do you think employers need to be sending you on training courses and things like that? Why do you think that's so important?
The essence of saying the employer send on a training course is to also learn from a diverse way which people carry out their role with the same standard and specification being spread out by the heart.
Yeah, it's so important that you are trained on, like you said, machinery or anything in that department, because it identifies that you're able to provide, do the work around it. Next, we're going to go on to 2.2, which is assessing the need for continued professional development in health and social care. And we looked at a little bit of it now, why CPD is so important. It's really important within the healthcare social profession to keep up to date with the legislation, the regulations, the policies and codes of practice. And it's really, really important that you are up to date with any sort of practices, any changes, any lifelong learning. And, if you, within the health and social care, CPD is really important because it directly impacts on the quality of care provided. So you need to make sure that within the health and social care profession, everyone is trained. They are attending training programs. They are looking at developing their skills and being able to develop effective managers. Ultimately, the whole point of it is to have better quality and support. Some examples of CPD, things like reading and reviewing publications. It could be things like training sessions. It could be attending conferences, workshops, online conferences, webinars. Mandatory training would be things like, safeguarding. That's a mandatory training. Manual handling, again, would be a mandatory training. Taking part in clinical audits, shadowing, peer review activities, conferences, observations, webinars, podcasts. These are things that you need to be attending. Shadowing someone is really interesting as well. Attending any sort of lectures. It keeps everything up to date. You need to be attending conferences. You need to be attending any sort of research projects. You need to be being coached or mentored. These kind of things help within the healthcare profession, because I know when I remember going to a conference on FGM. I'm on the committee for female genital mutilation, and I went to a conference. I attended a conference, and I was a part of the conference, and there were lots of doctors and nurses there that needed to be trained. Now, that was a new area at that time, FGM, and it wasn't recognized as much as a form of abuse. But now doctors and nurses, or any sort of healthcare professional, not just within healthcare, within education, you need to be able to recognize if there's any sort of signs of FGM. And it was an area that we needed to train people in. And we had to do things like webinars. We had to have conferences. I organised a conference 3 times within the university that I work with, to enable people to be able to become aware of that. And it wasn't just healthcare professional that attended. It was people from the West Yorkshire Police, it was solicitors firms, it was previous victims of FGM. So, you know, you need to be, you know, in any area, be it domestic violence, be it FGM, be it, you know, any sort of new developments in cancer, anything, you need to have training. Why do you think training is so important? Or having any sort of, you know, reviewing publications or any sort of shadowing? Why do you think it's so important?
So that you know what you're doing and can do the best thing for your patient.
Yes. And also, would it be looking at certain implications of it as well? You know, knowing what the implications are of, you know, any forms of, you know, if anything's happening, you know, you need to know the new developments. Why is, you know, you need to be able to identify any sort of developments, and, you know, you need training around that. You know,
So
it's
you can identify the abuse as well.
yeah, it's such a, you know, wide area is CPD, and, you know, how you can get trained and webinars and things like this. I know, Islamia, you said you work within, you were doing, do you do care work? Islamia, Islamia, okay, it's okay. Olu, do you work within the care sector as well?
I do work in the care
Oh,
center.
sorry, Islamia, you're back now.
Sorry, I'm just.
Do you have a lot of training around areas that you may not be, like, you know, familiar with?
Yeah, I mean, when I was newly in the care, so because I wasn't familiar with so many things, like,
Yeah,
but now I think I've catched up so
good.
many.
Do you
So,
think it helps?
pardon?
Do you think it helps you having all
Oh,
this
sure, of
training?
course, definitely. It helps because you don't want to make a mistake, you know?
Yeah, yeah,
So
and
it
it
helps.
also, it helps your skills, improve your skills, doesn't
Exactly,
it?
exactly.
Yeah, and
It
it makes
does
it.
help.
I mean, I'll be honest with you. I work. I'm a chair for an organisation, a charity that deal with domestic violence. And I'm also on the FGM committee. So if I wasn't if I didn't know, because my background is human rights, but I teach family law as well, so a lot of domestic violence goes in there. But if there were some things I didn't know, but I've been there 5 years now, I'm the chair of the organisation, and I can, you know, say things that I wouldn't be able to have said previously. You know, I wouldn't have known. The same with the FGM committee. You know, there's things that I would have never known if I wasn't on the committee. So I think training, attending training, having these webinars, reading around it, reading publications, you know, analyzing peer reviews, these kind of things really help your skills and develop your skills as well, you know, and maintain that knowledge. Because, you know, it makes you understand things from, well, it makes me understand things from, you know, both perspectives, not just from one perspective. You know, it's really interesting to be able to learn new things. And I think with CPD, you should always allow that from your employee and encourage, you know, any sort of, your employers should encourage that. So CPD in the healthcare, so within the healthcare is to ensure that, you know, people work in the field and develop any set of necessary knowledge, but, you know, they is to look at the quality of life, you know, to try and, you know, make sure that the quality of care that they're giving is right, you know, and develop, you know, their careers. Sometimes, you know, CPDs for them to enhance their career and also make sure that they, you know, they have continued professional development, and it's a learning experience which will develop and improve their professional practice. So, you know, it's really important to have that in place. The benefits of CPD. So there are certain amounts of benefits of doing CPD. You know, CPD allows you to stay motivated and engaged in your work. and also develop your leadership skills, management skills. And does anyone know, can you give me an example of any benefits you think that CPD provides for you as an individual? Islamia, why do you think CPD is good for you? Jessie, why do you think CPD is good for you? How do you think it benefited you?
I'm not sure.
So if you go on a training course, how do you think that would benefit you?
Just improving knowledge, making sure you're doing the right thing.
And why do you think that's so important in your field? If you're going out and you're saying, you know, I need training on working with children with mental health or, you know, with autism or something, how do you think that would improve?
It would make sure I'd react in a way that would be better for the child.
Yeah. It makes sure that, you know, you would react to a way that they would understand, or, you know, how, you know, they would give you examples of putting things in practice. And it's also evidence that, you know, you are, you know, progressing and being able to learn. Although, what about you? How do you think CPD helps you? It's not there. Olu, no?
So I'll just give a brief example of something.
Okay, can you hear me now?
Okay, let's let it go first. I'll let him go first.
So you know, as a care worker, a time comes on my line of job that I observe that some of the people that I'm trying to care for really need a support work. So I have to go for anesthesis training on a prevention and management of the violent people, which is a mental health course, so which is PVMA and the GSA stuff. So in the process, because when I was having that challenging time in my role, I don't know what to do to assist those residents. And those behaviors just quickly came up. But over time, when it happened to come up, in that particular time of time, there is no one that can even, sometimes you have to be getting back to their house to do this. But by having that required training, I was able to just solve the issue without making any request from any quarter, and it's given me a soft landing.
Yeah, so it does help you, doesn't it, your CPD training?
It helped me to upskills.
Yes, excellent. And, you know, it's there to benefit you as an individual and develop sort of knowledge and skills.
It reduced my stress.
Yes, good, yeah. And it's also there, you know, to improve your knowledge and skills as well.
Yes.
Yeah. Islamia, what were you going to say?
So I was just going to say, like, so when Olu just said about his own experience, so I just thought, like, in terms of that PMV training, I've had something similar in the past as well. So initially, I thought it was something I could do on my own, like, oh, it's so easy. And when I went for training, it was an eye-opener for me, like, instead of before those things escalated, there's a way you can manage people before they get to that level where you could, I mean, go and you know, intervene with them. So I think that training really helped as well. Like the one I wanted to say earlier was I had a training. I paid for the training on my own, like observation and engagement training with people, how to document. Like obviously I can document things, but I think taking that extra training really helps and keeps you in check. Like, oh, you've been like this, oh, this site ought to be, you know. So the training really helps and keeps you up to date with things.
Up to date, It keeps you up to date with any sort of standards or any regulations that you need to follow.
Exactly.
And it helps you.
Something you could just overlook, like, oh, I can do it. But then again, it has to be professionally done.
Yeah. And sometimes, like you said, you can overlook things, can't you? You won't think about it. but professional development helps you improve. And also, you know, for organizations, it's good that you have CPD. You know, it promotes this healthy environment around it. So 2M1, assess the continuing professional development requirements for the chosen health and social care area. So all social workers, as we said, continuous professional development. It promotes activities within learning and development and enhances a worker's ability to practice things safely and effectively. You know, it said here that social workers should have been registered with the Health and Care Professional, HCPC, but now has been taken over by Social Work England. Prior to the takeover of Social Work England, those who wish to remain in social work register at HCPC to demonstrate the continued professional development every 2 years by providing evidence of maintaining up-to-date training. They need to make sure they provide evidence, and you know they need to have continuous professional development depending on the work role, the setting. They need to make sure that they are up to date and all the necessary training and opportunity to widen their knowledge base are set. You know, they've done the skills they need to for social work. What counts as CPD for health and social care workers? So CPD in health and social care working is really important in regards to any sort of elements of, you know, keeping up to date, making sure that, you know, you have followed the elements of, you know, the professional development, continuous professional development, and undertaken, you know, you are maintaining any sort of gaps in your knowledge, because we all have gaps in our knowledge, skills, and competencies. You know, we're not all, you know, perfect. You know, observation and shadowing is really good. Attending workshops, as we said, you know, trying to keep up to date, and I encompass a wide range of activities designed to ensure that you are up to date with any sort of latest developments. Best practices, you know, working, mentoring with each other is really important. And it adds to your skills and professional identity. And, you know, when you're working in the healthcare profession, health and social care profession, you know, you're constantly changing and there's challenges. So learning new things and improving, you know, your CPD will help you identify and develop your skills and knowledge. You know, it could be things like, you know, like we said, webinars, it could be mentoring, it could be CPD training, it could be courses for healthcare, you know, clinical skills training, it could be communication skills training. I think, you know, some effective communication, like we said, is really crucial within the healthcare profession. So, you know, communication, like Olu said, is one of the key elements. So, you know, having communication skills training is really important. Mental health awareness, and obviously things like, you know, leadership training. And when you have this training, it helps improve any sort of increases your confidence as an individual. It identifies any sort of career developments. And also, you know, things like you staying current. So if the laws are changing or anything's changing, you are up to date with what all the changes and everything. The importance of implementing strategies. So, you know, you will have things like, you know, integrating CPD into your daily routine, which we'll be looking a little bit later on, maybe learning outcome 3 and 4, SMART goals, you know, focusing on your achievements and your goals throughout, you know, maintaining that you are able to, you know, have this continuous professional development, make sure that you are, you know, putting yourself forward for courses and things like that to make sure that you are up to date and on top of things. So we've done learning outcome 2 now. These are some of the references here. Has anyone got any questions? Just to conclude in today's session that we've done learning outcome 2, we've looked at membership of professional bodies, codes of practice, we've looked at acts, statutes, we've looked at continuous professional development, why is required, and professional requirements. These are some of the links here for websites that you can go on that will help you in regards to legislation and CPD and things like what we've done in today's session. We've got ebooks, and on Moodle there's additional reading that you could refer to. We've got the Improving Continuing Professional Development, National Occupational Standards for Health and Social Care Workers, Principles for Continuing Professional Development, and these are all on Moodle for you to learn read. And if you have any questions, again, learn or work at ukvarsity.co.uk. Have you got any questions around learning outcome 2 that we've done today?
Oh, sorry, Shazia. Well, where
Yes.
can we download the recorded version for us to be able to,
This will be
sometimes?
this will be available on Monday for you on Moodle.
Okay, from
Okay.
Monday.
Yes, tomorrow. Tomorrow,
Okay.
everything will be available for you on Moodle.
Okay.
Okay. If you have any issues with getting onto Moodle, just email learnerwork@ukvarsity.co.uk.
Okay.
Everything will be on there, all the recordings, all the additional reading, any sort of ebooks or anything that you need to help you with the assignment or understanding certain concepts are on there. If you don't understand anything, you could just email me as well. And also, if you've got any questions, just ask as well. And I like this interactive type of teaching. I don't know how you lot feel. I think when I'm asking you questions, it gets you understanding the certain concepts as well.
Yes.
Is that okay?
Yes.
Jessie?
Yes. I did have one question. I have
Yes.
looked at the assignment.
Yeah.
And with task 2, it talks about considering your own professional development.
Yes.
However, I'm still in school. I do some voluntary work, but I'm still in school. Should I choose a job and research it as my own?
Which is it, task 2? I mean, you could, you know what you could do? You could maybe look at your own professional development in the voluntary side.
Yes.
Yes, that would maybe be a good one to look at.
Yeah.
So what we'll do, we'll discuss more of this towards the assignment discussion, okay? But I think personally you could use your voluntary work.
Yeah. Okay, thank you.
It's okay. Has anyone got any other questions, Islamia? Anything else?
No, I'm all right. Thank you.
Okay. Thank you. And I will see you all. Sorry, I've run over time. We always seem to run over time. But I will see you in the next session, which is next Saturday, okay, at 11 o'clock.
Okay. See you. Take
Thank
care.
you.
Bye.
Thank you, everyone.
Yeah.
Bye.
Thank you. See you next week. Bye.
Yeah.